Embryology. Spermatogenesis. Haploid number of chromosomes is seen in secondary spermatozoite. Meiosis in spermatozoite occurs during the process of conversion of primary spermatozoite to secondary spermatozoite. One primary oocyte forms one ovum. Meiosis occurs in human males in seminiferous tubules. Spermatogenesis occurs at temperature lower than core body temperature. Sperm acquires motility in epididymis. Sperm maturation or capacitation takes place in female genital tract. After first meiotic division, the primary oocyte remains arrested in diplotin stage of prophase 1. In a female child, at birth oocyte is in stage of prophase, first meiotic. Polar bodies are formed during oogenesis. Pre-embryo phase. Fertilized ovum reaches the uterus in 3 to 4 days. Implantation occurs at 6 to 7 days. Implantation occurs at stage of blastocyst. Outer layer of blastocyst forms the trophoblast. Morula is a 16-celled stage. During the third week of human embryo development, primitive streak formation takes place. Disc with 3 germ layers is formed at 3 weeks of gestation. Notochord develops in third week. Indicator of start of gastrulation is formation of primitive streak. Gastrulation establishes all 3 germ layers. Development of peritoneal cavity is from ectoderm. Pericardial cavity is an intraembryonic coelomic cavity. Somites initially form at cervical canal. Regarding the vertebral development, sclerotum surrounds the notochord and neural tube. Lumbar hemivertebra results due to abnormal development of ventral sclerotum. Embryological development of human vertebra is from somite. Paraxial mesoderm contributes to the development of skeletal muscles. Closure of neural tube begins at cervical region. Nodal gene has important role in initiation and maintenance of primitive streak. First to be developed is primitive streak. Remnant of notochord is nucleus pulposus. Embryonic phase of development 4 to 8 weeks. Embryonic period of development is up to 8 weeks. Internal organs in the fetus develops at 6 weeks. Paraxial mesoderm develops into somites. Lymph nodes are derived from mesoderm. Muscular component of dorsal aorta develops from lateral plate mesoderm. Crystalline lens develops from surface ectoderm. Microglial cells are mesodermal in origin. Structure which develops from neural crust is adrenal medulla. Urbach plexus and Meissner's ganglion cell are derived from neural crust. Melanoblasts are derived from neural crust cells. Corneal stroma is derived from lateral plate mesoderm. Amyloblasts in teeth are derived from ectoderm. Sphincter and dilator pupilla develop from neuroectoderm. Placenta and fetal membranes. Placenta develops from decidua basalis and chorion frondosum. Amnion is present on fetal surface. Right vein disappears in umbilical cord. Umbilical cord has 2 arteries and 1 vein. Cytotrophoblast invades decidua basalis. Systemic embryology. Maxillary prominence develops in first pharyngeal arch. The endoderm and ectoderm approach each other in head and neck region during the 4th week in pharyngeal membrane. Tympanic membrane represents all 3 components of embryonic disc. Artery of second pharyngeal arch is stapedial artery. Nerve of 6th arch is the recurrent laryngeal nerve. Palatine tonsil develop from second pharyngeal arch. Gland derived from foramen cecum is thyroid. Parafollicular C cells of thyroid develops from neural crest cells greater than ultimobranchial body. Skeletal derivative of second pharyngeal arch is stapes. Footplate of stapes is developed from otic capsule. Richard's cartilage is the cartilage of second arch. Greater cornea of hyoid is derived from cartilage of third arch. Thymus developed from third pouch. Nerve of sixth pharyngeal arch is vagus. Posterior one third of tongue develops from hypobranchial eminence. Tongue muscles are derived from occipital somites or myotomes. The glossopharyngeal nerve supplies the posterior part of tongue because it develops from hypobranchial eminence. Epiglottis is derived from fourth arch. Cardiovascular system. Jelly formed around the heart tube during early development contributes to the formation of myocardium. Unequal division of conus cordis results from anterior displacement of cone truncal septum give rise to tetralogy of Fallot. Heart is fully developed at third month of intrauterine life. Right horn of sinus venosus forms smooth wall of right atrium. Coronary sinus develops from left horn of sinus venosus. Foramen ovale closes because of fusion of septum primum or septum secundum. Fossa ovalis is the remnant of septum primum. Double aorta occurs due to persistence of distal portion of right dorsal aorta. Commonest variation in arteries arising from arch of aorta is left common carotid artery arising from brachiocephalic trunk. Ductus venosus connects portal vein and inferior vena cava. The most important structure involved in development of inferior vena cava, supracardinal vein, subcardinal vein. Structure derived from right fourth aortic artery is right subclavian artery. Left-sided superior vena cava drains into coronary sinus. Double inferior vena cava is formed due to persistence of subcardinal veins. Gastrointestinal development. Primitive gut is a derivative of yolk sac. Duodenum is derived from foregut and midgut. Rectum develops from hindgut. Small intestine develops from midgut. Anal membrane lies at proximal part of proctadium. Artery of hindgut is the inferior mesenteric artery. Before formation of head and tail folds, the most cranial part of embryo is septum transversum. Ligamentum teres of liver is a remnant of left umbilical vein. Most common site of ectopic pancreatic tissue is stomach. Genitourinary system. Collecting tubules of kidney develop from ureteric bud. Epithelium of ureter develop from mesonephros. Proximal convoluted tubules develop from metanephric tubules. Urorectal septum separates from cloaca into rectum and urogenital sinus. Bladder develops from endoderm. Urachal fistula is patent allantois. Differentiation of genital reds takes place at 2 months. Primordial germ cells are derived from the yolk sac endoderm. Germ cells in the ovary develop from yolk sac. Number of primordial follicles in ovary at birth are 2 million. Development of labia majora is from genital swelling. Scrotum is analog to labia majora. Genital swelling in male differentiates into scrotum. Clitoris develops from genital tubercle. Leydig cells are derived embryologically from mesoderm of gonadal ridge. Origin of ovary is from genital ridge. Mullerian ducts mainly forms female genital organ. Appendix of epididymis is derived from Wolffian duct. Vaginal wall is derived from endoderm of urogenital sinus and mesoderm of Mullerian duct. Upper two-thirds of vagina develops from Mullerian duct. Vaginal epithelium develops from endoderm of urogenital sinus. Vaginal epithelium develops from endoderm of urogenital sinus. Uterus and cervix develop from Mullerian duct. Uterus and cervix develop from Mullerian duct. Upper two-thirds of vagina develops from Mullerian duct. Vaginal epithelium develops from endoderm of urogenital sinus. Vaginal wall is derived from endoderm of urogenital sinus and mesoderm of Mullerian duct. Appendix of epididymis is derived from Wolffian duct. Mullerian ducts develop mainly forms female genital organ. Origins of ovary is from genital ridge. Leydig cells are derived embryologically from mesoderm of gonadal ridge. Clitoris develops from genital tubercle. Genital swellings in male differentiates into scrotum. Scrotum is analogous to labia majora. Development of labia majora is from genital swelling. Number of primordial follicles in ovary at birth are 2 million. Germ cells in ovary develop from yolk sac. Primordial germ cells are derived from yolk sac endoderm. Differentiation of genital leads takes place at 2 months. Urachal fistula is patent allantois. Bladder develops from endoderm. Urorectal septum separates the cloaca into rectum and urogenital sinus. Proximal convoluted tubules develop from metanephric tubules. Epithelium of ureter develops from mesonephros. Collecting tubules of kidney develops from ureteric bud. Most common site of ectopic pancreatic tissue is stomach. Ligamentum teres of liver is a remnant of left umbilical vein. Before formation of head and tail folds, most cranial part of embryo is septum transversum. Artery of hindgut is inferior mesenteric artery. Anal membrane lies at proximal part of proctarium. Small intestine develops from midgut. Rectum develops from hindgut. Duodenum is derived from foregut and midgut. Primitive gut is derivative of yolk sac. Double inferior vena cava is formed due to persistence of subcardinal veins. Left-sided superior vena cava drains into coronary sinus. The structure derived from right fourth aortic arch is the right subclavian artery. Most important structure involved in development of inferior vena cava are supracardinal vein and subcardinal vein. Ductus venosus connects the portal vein and inferior vena cava. Commonest variation in arteries arising from arch of aorta is left common carotid artery arising from brachiocephalic trunk. Double aorta occurs due to persistence of distal portion of right dorsal aorta. Fossa ovalis is a remnant of septum primum. Foramen ovale closes because of fusion of septum primum and septum secundum. Coronary sinus develops from left horn of sinus venosus. Right horn of sinus venosus forms smooth wall of right atrium. Heart is fully developed at third month of intrauterine life. Unequal division of conus cordis resulting from anterior displacement of contruncal septum due rise to tetralogy of Fallot. Jelly formed around heart tube during embryo early development contributes to the formation of myocardium. Maxillary prominence develops into first pharyngeal arch. Endoderm and ectoderm approach each other in the head and neck region during fourth week in the pharyngeal membrane. Tympanic membrane represents all three components of embryonic disc. Artery of second pharyngeal arch is stapedial artery. Nerve of sixth artery is the recurrent laryngeal nerve. Palatine tonsil develops from second pharyngeal pouch. Gland derived from foramen cecum is the thyroid artery. Parafollicular C cells of thyroid develops from neural crest cells greater than ultimobranchial body. Skeletal derivatives of second pharyngeal arch is stapes. Footplate of stapes is developed from otic capsule. Richard's cartilage is the cartilage of second arch. Greater cornea of hyoid bone is derived from cartilage of third arch. Thymus develops from third pouch. Nerve of sixth pharyngeal arch is vagus. Posterior one-third of tongue develops from hypobranchial eminence. Tongue muscles are derived from occipital somites and myotomes. Glossopharyngeal nerve supplies the posterior part of tongue because it develops from hypobranchial eminence. Epiglottis is derived from fourth arch. Placenta and fetal membranes. Placenta develops from decidua basalis and chorion fundosum. Amnion is present on fetal surface. Right vein disappears in umbilical cord. Umbilical cord has two arteries and one vein. Cytotrophoblast invades decidua basalis. Embryonic phase of development. Embryonic period of development is up to 8 weeks. Internal organs in the fetus develops at 6 weeks. Paraxial mesoderm develops into somites. Lymph nodes are derived from mesoderm. Muscular component of dorsal aorta develops from lateral plate mesoderm. Crystalline lens develops from surface ectoderm. Microglial cells are mesodermal in origin. Structure which develops from neural crest is adrenal medulla. Auerbach plexus and Meissner's ganglion cells are derived from neural crest. Melanoblasts are derived from neural crest cells. Corneal stroma is derived from lateral plate mesoderm. Ameloblasts in teeth are derived from ectoderm. Sphincter and dilator pupil are developed from neuroectoderm.